Hello, I'm Dr.RAKHE Jayamohanan, specialist dermatologist working in Mampilly Medical Center. Welcome all to today's session. Today we will be looking into some of the common skin conditions. Now, a very common problem that we all face is eczema. So what is eczema and what does it look like? So eczema may start as a red rash, which is pruritic, and it can progress to large lesions covering more parts of the skin, and it can become a weeping lesion. So a weeping skin lesion is called an eczema, and if not treated adequately, it can progress to involve the entire body and lead to a condition called exfoliated dermatitis. That is similar to skin failure, which is a severe condition. So now you know what is eczema and what it looks like. What can we do about it? The best plan of action is to consult a specialist and take adequate treatment, because each treatment is tailored to the specific type of eczema and the stage of eczema. Now we need to know what we are going to do about this eczema, what you should do and you should not do. Do not apply any corrosives, any disinfectants, hot water to any lesions of eczema, especially the oozing lesions. However, a wet compress with cold water may be helpful in decreasing the oozing from the lesion, of course along with proper medication as directed by the doctor. And several other eczemas are there. For example, among children, it is very common to see oozing lesions on the cheeks and on the arms and legs of small babies. And in bigger children, older children, you will find that these lesions occur on the folds of the skin. This is known as atopic dermatitis, which is also a type of eczema. It is a very pruritic condition which will make the children lose their sleep at night. Another type of eczema is sensitivity to various everyday products like cosmetics, nickel of watch straps, hair dyes, and detergents, and several others. These sensitivity, the skin sensitivity, may develop as eczema. Then another type of eczema is seen in people suffering from varicose veins. It is known as varicose eczema, and so forth. The list just goes on. Next, we will talk about some of the common skin infections. Skin infections can be caused by bacteria, fungi, and viruses. The bacterial skin infections, it can occur in children. It is known as impetigo. Impetigo is seen as a superficial skin infection, and they appear as honey-colored crusting over the skin around the nose, the mouth, and other parts of the face. And it can also involve the upper part of the body and arms. These are very superficial infections, but they do need prompt treatment. Then another type of infection is folliculitis, which is a superficial infection of the hair follicle. And a deeper infection of the hair follicle is known as furunculosis. Of course, this is seen in adults, sometimes in children also. Deeper infections and more severe infections are known as abscesses, cellulitis. All these require a very prompt and adequate treatment. So of course, abscess is a very deep-seated collection of pus in the skin, and cellulitis is a spreading infection of the skin. So you should understand these are very important and severe infection and seek medical advice. During summer months, however, the most common troublesome infection are the fungal infection. So what do they look like? Now, fungal infections can be different types. It can be the ringworm infection or the tinea infections or the candidal infections. Now, what are tinea infections or the ringworm infections? Ringworm infections, they start as red raised pimple-like lesions, but they can spread to become round, red and extremely pruritic lesions, mostly seen in the skin folds like the groin, the armpit. It can also become extensive, involving more parts of the body if not treated early. If they are extensive lesions, they will need prolonged therapy. In this context, let me remind you, do not apply any of the over-the-counter medications, especially those containing steroids or steroids as part of their combination in case of fungal infection, because steroid medications are known to only suppress the symptoms, the itching and the redness, but they actually aggravate the underlying infection. So be very careful while using these creams, because if not treated with the right kind of medication, the treatment may lead to treatment failure and prolonged courses are warranted. So next we will see about the viral infections. Of course, we are very familiar with chickenpox that is seen commonly in children, and it is seen as clear fluid-filled lesions that occur on the body and may be associated with fever and other symptoms. This infection, as you all know, is highly contagious and it can spread to those individuals with whom the patients have a close contact. So it is advisable to stay away from pregnant ladies and very small children, because in them the infection may take a turn for the worse. Then the same virus, the virus that causes chickenpox, may cause a different manifestation in an adult. It is known as herpes zoster or shingles. That is seen as clear fluid-filled grouped vesicles. It is seen on one part of the body and it is sometimes or usually associated with severe pain. In case of either of the infections, it is advisable to take adequate treatment from a specialist. Now, since COVID, many of us have a very difficult problem, that is hair fall. So we will discuss something about hair fall. What are the causes and what can be done about it? So normally, on an average, one may lose about 100 hairs per day, but excessive hair fall can have multitude of causes. One is a prolonged infection, anything like COVID, for example. Following the infection, 3 months later, you may experience drastic hair fall. It can be due to any physical or mental stress. This is known as acute telogen effluvium. When this is prolonged and it happens for more than 6 months, it is known as chronic telogen effluvium. So when does it become a problem? When the patient loses excessive hair. Other common causes of hair loss can be nutritional deficiency, hormonal issues like PCOD, thyroid disease, any hair and scalp fungal infections, disorders of the hair shaft, etc. Now, more troubling than these for the people is baldness or male or female pattern hair loss. In males, baldness can manifest as a receding hairline, where the frontal hairline recedes backwards, and in females, it may appear as thinning of the hair of the central parting. So now let us see what we can do about hair fall, how to tackle the problem of hair fall. A good hair care regime is very important, but avoid excessive heat treatments, chemical treatments. Keeping the hair and scalp clean with a gentle cleanser and a mild conditioner will go a long way. A proper diet, stress control, exercise, etc. are good for the skin and hair in general. Your doctor may also prescribe specific medications depending on the cause of your hair fall and suggest various procedures. A PRP treatment is the injection of growth factors that potentiate hair growth in individuals where it is indicated. So here in this procedure, in pre-RP treatment, the growth factor from one's own blood is injected into the hair to potentiate the hair growth. And finally, now we will discuss some of the common pigmentary problems of the skin. Melasma is a very common pigmentary disorder that is seen both in men and women, but most commonly in females. They are seen as dark brown pigmented spots that appear on either side of the cheeks, on the nose, on the forehead, on the jaw. It can even occur on the chest and forearms. It is seen to be exacerbated by exposure to sunlight. Pigmentation can also occur following acne, healing of acne, pimples, then healing of any wounds or inflammation that has occurred. So pigmentation can be a part of your birthmark. So there are different causes for pigmentation. It can occur as a result of any type of allergic reaction to cosmetics. So the treatment also depends upon the cause, and the individual treatment is tailored to the specific need of the patient. However, sun protection is a major component of any treatment for skin. So use of sunscreen is a must. Now, another less common problem is the presence of scars. It can be in the form of stretch marks, striae, scars that have formed after the pimples have healed. Then there can be hypertrophic scars, keloids. So again, these are problems that can be tackled with various modalities of treatment tailored to the individual needs of the patient. I hope these information is useful, and I hope that the common skin condition is identifiable, and I hope you have understood the importance of taking timely treatment and medication, and the right kind of medication from a specialist. We have discussed some of the common skin problems today, and we'll be discussing them in the coming episodes in detail. Thank you.